Good morning. I'm Dr. John Hall from New South Wales Health with the COVID-19 update for Sunday, the 12th of December 2021. There were 485 cases of COVID reported in New South Wales in the 24-hour period to 8 p.m. last night. There were more than 90,000 COVID tests reported during that same period. There is a total of 55 cases of COVID-19 with the Omicron variant in New South Wales. 14 of these cases were acquired overseas or on an international flight. The other 31 cases were locally acquired. There are currently 156 COVID cases admitted to hospital, with 23 people in intensive care, 7 of whom require ventilation. There is one case with the Omicron variant admitted to hospital for COVID-related care in New South Wales. Across New South Wales, 94.8% of people aged 16 and over have received a first dose of COVID-19 vaccine, and 93.1% are fully vaccinated. Of the people aged 12 to 15, 81.4% have received a first dose of COVID-19 vaccine, and 77.7% are fully vaccinated. Sadly, New South Wales Health is reporting 2 deaths. A man in his 70s from Sydney's inner west died at Concord Hospital. He was not vaccinated. A man in his 80s from southeast Sydney died at Sutherland Hospital. He was not vaccinated and had underlying health conditions. New South Wales Health's ongoing sewage surveillance has detected fragments of the virus that causes COVID-19 in sewage samples collected from Wellington, Southwest Rocks, Raymond Terrace and Boulder Bay, where there are no recent known cases. Everyone who has been in these areas is urged to monitor for the onset of symptoms and, if they appear, to immediately be tested and isolated until a negative result is received. We'd like to advise the Newcastle community that we are concerned about transmission at the Argyle House nightclub, which was visited by a confirmed case of COVID-19 likely to have the Omicron variant of concern. A public health investigation is underway into transmission of the virus at this location, which is linked to a previously reported outbreak on a party boat cruise on Sydney Harbour on the 3rd of December. This is one of a number of large social venues such as pubs, clubs and party settings where there is increasing COVID-19 transmission. This is contributing to the increase in cases in New South Wales, and we want to reiterate just how important it is for people not to attend social functions if they have any symptoms, even if they're mild. If you do attend, please check in using the QR code. Clearly, we have seen a number of outbreaks recently across Sydney and now in Newcastle after people likely to have Omicron variant of concern attended social gatherings. This is why it's so important, as the festive season is underway, that everyone remains vigilant when gathering to celebrate with friends, family and colleagues. There are several precautions you can take when planning for these occasions. Get together outdoors for group celebrations if you can. If celebrating indoors, choose large, well-ventilated spaces and open doors and windows. Something everyone can do is consider using a rapid antigen test or RAT before they go out, if they do not have symptoms. There is great information on how to use rapid antigen tests on the New South Wales Health website. I want to stress that rapid antigen tests are not to be used if you have symptoms. If you have symptoms, you need to attend a testing clinic for a PCR test and, of course, stay home. New South Wales Health also strongly encourages people to wear a mask in situations where they cannot physically distance, especially indoors. The emergence of the Omicron variant is a timely reminder of the importance of keeping up all our COVID-safe practices and getting tested at the earliest sign of symptoms. Again, thank you for your continuing efforts to get vaccinated, get tested, and helping to limit the spread of COVID-19. Please stay safe.